Good afternoon, everyone. I'm here to talk about the Roundtable's activities over the past year to get back on track. Let's jump through space and time back to January 2020 when we launched We're in 2020 for HPV Cancer Prevention. We were fortunate to partner with HHS for this wonderful launch for health systems to prioritize HPV vaccination. Then, as we've talked about over the last 2 days, the pandemic hit, completely upending healthcare as we know it. So we had to make adaptations. And so we communicated with health systems that had signed on. We had 45 plus organizations that signed on, and we continued to hold webinars over the course of the year and send emails and adapt our messaging to the new environment, creating a new webpage for Back on Track, creating new infographics and social messages. We also did messaging direct to parents to help reiterate those messages about still coming in to get vaccinated. We convened stakeholders last summer, national organizations, to make sure we're information sharing, as well as assessing together what the priorities should be. We catalyzed and convened public health partners, as well as health plans and health systems, and then published the findings of those focus groups in a promising practices document last summer. In addition, the Best Practices Task Group published a commentary in the Journal of Adolescent Health. So as we move towards 2021, we got input from our members on how do we move forward and how do we get back on track. So we made this shift to public health forums. In March, on International HPV Awareness Day, we partnered with NCQA and ACS to host a national webinar to get health plans to help position HPV vaccination and overall adolescent immunization. We had almost 600 people attend live. We also adapted that messaging into calls to action for health plans to have a plan in March to May, and then adapted that for health systems as well, and how to not only do what they already did, but then link them to current information from CDC. We continued to update and create new resources for toolkits, infographics, social media that addressed key messages that parents were looking to hear about safety, access, clinic readiness, as well as making sure that we keep our eyes on the HPV with Healthy People 2030 goals. We know that after that NCQA webinar that we found what materials were most valuable to attendees, thanks to a post-event survey, as well as the fact that 70% of those survey respondents indicated a willingness to take action. We also hosted a spring mis and disinformation webinar, which to date is our most popular viewed video on YouTube, over 8,600 views. So we are reaching people with this valued messaging. So after this meeting, we're going to take all the input from the 2 days of breakout sessions and develop new resources, but also develop new strategies. And so one of the things is leaning into age 9. And so this is a prototype of a new resource that we're developing maybe in time for this meeting. Thanks.